I am Dr. Meenakshi, and I would like to talk to you today about a very pertinent and important topic called air pollution and also the impact of it on our health and why it is so important. So, I work at Apollo Noida and I'm a family physician and a public health physician. I would like to start with just the definition of air pollution. This is the contamination of the indoor or outdoor environment by any chemical, physical, or biological agent that modifies the natural characteristics of the atmosphere. So, the contaminants could be anything from dust, fumes, gas, mist, odor, smoke, or vapor in different quantities and for the duration to which it could be injurious to the health. So, it could be in the form of gases, liquids, anything present in the atmosphere which is causing harm to humans, organisms, and the materials over here. Coming to an overview of this, the air pollution is mainly through the exposure through the respiratory tract. And this leads to breathing problems, which leads to inflammation, oxidative stress, immunosuppression, even cancer, mutagenicity in the cells in our body, and impacting every part of the body, including the lungs, heart, brain, and ultimately leading to disease and death. So, morbidity and mortality, which is contributed and attributable with evidence-based studies. The age group which is affected, it could be anywhere from children to adults, and the levels and the duration of the exposure can be considered safe, which can be varying from a different pollutant to the disease outcomes. And some of the pollutants, there are no thresholds at all. Sometimes high particulate matter can lead to reduced lung function, respiratory infections, which we see very commonly now, and also aggravated asthma from even short-term exposure. The long-term or the chronic exposure to fine particulate matter increases a person's risk for diseases with a longer onset and leading to some of the non-communicable diseases also. So essentially, children, elderly, and the pregnant women are more susceptible to the air pollution related diseases. And most importantly, the genetics, comorbidity, nutrition, and the socio-demographic factors impact the person's susceptibility to the air pollution. The maternal exposure to this has also been seen to reduce the birth outcomes, such as low birth weight, still birth weight, and also leading to preterm births and small for gestational age births. In children, we have also seen diabetes and neurological development, which is hampered and seen because of the effect of air pollution. So, coming to the emission of the pollutants, air pollutants are emitted into the atmosphere, and there could be primary or secondary air pollutants. The primary air pollutants are such as the factory chimney or exhaust pipes, and the secondary air pollutants could be ozone. So the ozone layer covering the earth as well is affected. So the main sources from us for the air pollution that we see usually are because of automobiles, from the motor vehicles, the diesel engines, the industries, the fuel which is coming out from the industries leading to and its combustion, leading to smoke, fly ash, sulfur dioxide, sulfur nitric dioxide, petrochemicals, the waste discharges from the industries. And the domestic sources could be like coal, wood, or oil, which is being used in the house, in the indoor. tobacco smoke, which could be from the smoker and also leading to passive smoking by other people. So these are all causes of the air pollution. And also miscellaneous things like refuse, the incinerators, where we burn most of our medical waste, the pesticide spraying, the nuclear energy programs, and the natural resources as well. So the natural resources could be from wildfires, volcanoes, methane, and dust. And of course, the human resources, which we've been already talking about, the power plants, the automobiles, fumes, burning of wood, the stove that we use, the fireplaces, and the furnaces that are used commonly. There are two types of air pollution. There's outdoor and indoor air pollution. The outdoor air pollution has things which are differentiated as smog, which we often see, and over here now in India also, and particulates, and particularly in Delhi, NCR, the northern part, some parts we see a lot of smog and fog and particulates and the acid rain and the greenhouses gases. And of course, the indoor air pollutants are there. So the indoor air pollutants, you can see people smoking or using stoves and just taking wood to burn to keep themselves warm, and so many cigars, etc. And of course, the outdoor air pollution, the emission from all the diesel and the vehicles which use petrol. So these are all the causes of the pollutions. And now coming to the pollutants per se, we have particulate matter and carbon monoxide, nitrogen dioxide, the sulfur dioxide, ozone, and fine particulate matter. So all these pollutants actually are very, very important, and they lead to health problems. So by coming to each one individually, the particulate matter is a common proxy indicator for the air pollution. And its major components are sulfates, nitrates, ammonia, sodium chloride, black carbon, mineral dust, and water. And carbon monoxide, which is because of combustion of the carbonaceous fuels such as wood, petrol, charcoal, natural gas, and kerosene. So this is a colorless and an odorless and tasteless toxic gas. Ozone, which is at the ground level, is not to be confused with the ozone in the upper atmosphere. This is one of the major components of the photochemical smog that I talked about, and is formed through the reaction with gases in the presence of sunlight. And of course, then comes the nitrogen dioxide, which is because of combustion of fuels, again with transportation and the industrial sectors being commonly found. Sulfur dioxide is a gas with a sharp odor, and it's caused and produced with the burning of fossil fuels, which is coal and oil, and the smelting of the mineral ores that contain sulfur. So each of these things, as we see in the mechanism of what is happening, all these emissions are let out in the atmosphere and converted into nitric oxide and then nitrogen dioxide, and also HNO3, which leads to the acid rain. Also, all these components, along with some of the components such as nitric oxide, the nitrogen dioxide, and all the other pollutants, all, even in the rain, lead to problems and in the causing a disaster in the ecological system. So the primary mechanism, there are two mechanisms by which this could happen, the primary and the secondary. The primary one being formation of the VOCs, which is volatile organic compounds. And then what is happening is the biological generation of more of these and formation of liquid aerosol droplets and also some generation of the particulate aerosols. And all these lead to problems because once you inhale them, which affects the respiratory system first and foremost, of course. So just the biological formation also, and also of the particulate aerosols. And the secondary mechanisms, which is what I showed earlier. So what happens is condensation happens, the absorption and the nucleation of these. So these are circulated in the atmosphere and leads to all these problems. So the pollutant spread is a vertical diffusion, as we saw earlier, and it also depends on the temperature gradient. Temperature inversion is a very important aspect, mainly to see when we talk of smog, this becomes more relevant. And what is happening in temperature inversion is there is rapid cooling of the lower layers of the air, and there's a vertical motion, and the pollutants and the vapors remain trapped in the lower levels. That's resulting in the smog formation. So this is together with the fog and the particulate matter is leading to smog. And this is more common as we are also seeing now in the winter months or rather than the spring or the summer months, and leading to a lot of hazard in the human health. And not only the human health, there are other parts of the ecosystem which is disturbed, which I'll talk about a little later, which is affecting our health. So the impact as per se comes on the climate systems, the health, the economy, the environment, the ecosystem, the forestry, and the agriculture. And just because of all these, that it is affecting us. The human health, of course, is affected, and it leads to diseases and a lot of morbidity and comorbidity, and finally mortality. So the environmental effects are because of what I spoke about, the acid rain with the HNO forming, the eutrophication, the haze, the wildlife, the ozone depletion, the crop and the forest damage, and the global climate change happens because of all these reasons. So the all-cause mortality as in terms of human health, so what we see commonly, it is affecting us in different ways. Maximum that we see is in the form of strokes, which is about 32%. And you'll be surprised, but it leads to 12% of the deaths. And then followed by ischemic heart disease. So a lot of high blood pressure and heart problems that we are seeing, that's about 23%, leading to about 12% of deaths again because of the ischemic heart disease caused by air pollution. And lower respiratory tract infections, about 21%. And it is important to know this because about 44% of all the pneumonia deaths in children less than 5 years old is because of this. And about 22% in adults is due to the household air pollution. Also, chronic obstructive pulmonary disease, about 19%. So about 23% of the deaths are in the low and middle income countries, which is because of the household air pollution. The lung cancers, as I spoke of, mutagenicity, causing to cancer. That is approximately 11% of the cancer deaths is because of these carcinogens in household air pollutions. Pneumonia, again, a lower respiratory infection, cataract, the household air pollution only is leading to this. Adverse pregnancy outcomes in forms of what I spoke about, low birth weight, small for gestational age, and other cancers, diabetes, cognitive impairment, and neurological diseases have been seen. So what is happening is that there are emissions from different sources, which we see on the topmost thing. The motor vehicles, the aircrafts and the ships that we see, and the emissions from industries leading to the reactive gases. Carbon monoxide, sulfur dioxide, nitrous dioxide, nitric oxide, ozone, and the VOCs. And also there will be some transition metals, chromium, cadmium, lead, endotoxins, also quinones, reactive aldehydes, and all these are actually circulating and then affect the system, the autonomic system, which is in our body, and crosses the blood-brain barrier also, and through the respiratory system, which in the form of particulate matter, which will be coarse, fine, or ultrafine. So this is where the PM10, PM2.5, and nanoparticles are observed, and these are all inhaled. So our respiratory system from the nose to the lungs and to the alveoli, which is the main part where the gaseous exchange takes place in the lungs. That's where this is affected. And this is cyclical and leading to a problem in the blood vessels also, which is going to migrate from the oxygenation when it takes place, and when there's where oxygen is being taken into the blood vessels, some particles and gas also transmigrate, and that then coming and affecting the blood vessels, that is the endothelial activation, the platelets in the blood cells, leading to systemic inflammation and a lot of fibrosis, etc. Ultimately, what happens is that it also affects and leads to vasodilatation and decreases it, increases the vasoconstriction, that is the constriction in the blood vessels, and proliferation. They get deposited in the blood vessels, the particulate matter, and thus leads to hypertension. So how are we going to monitor this? Monitoring, what we hear of is one part only. There are other components such as the sulfur dioxide, the smoke and suspended particles, the grit and the dust measurement is also done. So the coefficient of haze, which is very common in the US, and also the air quality index, which we often are hearing and seeing. So 0 is the minimal and maximum being 500. And you can see where we have been going and leading to a lot of problems and effects. So each of these, the particulate matter and the ozone, the nitric oxide is measured in terms of time and how much is found and it's measured as microgram per meter cube. And we see how much is appearing in the atmosphere. So how are we going to reduce the pollution levels? So the indoor pollution, some of the recommendations are by eliminating or controlling the sources of the pollution, that is, improved stoves, clean fuels, the kerosene, the gas, the venting stoves for cooking and heating, regular maintenance of cooking, heating, and cooling mechanisms. So that is one of the ways in which one we can eliminate or control the sources of the pollution. And then, of course, the air. Another would be ventilation, the building design itself, to dilute and remove the pollutants through ventilation with the outdoor air, that is, through the ventilation systems. And the third being air cleaning. So, air cleaning, not necessarily with air fresheners, but air filters are very useful, and ionizers. These remove the particulate matter, and that's why it is effective and helping us achieve better air quality. And also gas absorbing, something which absorbs the gaseous contaminants in the body from the air, sorry. And also, how are we going to do this? The most important thing would be to educate and advocacy of it, to education in target audiences, to children, family, and community, and even the healthcare providers. So it becomes very important that we address it now and go about it unless we repent further. So, in the outdoor pollution, of course, we are using different mechanisms, condensation, when we see a lot of spraying of water happening, which is being looked after now, and leading to a lot of green belts. So, this is how we should be able to achieve some green belts so that there is more oxygen through the photosynthesis in the plants, and leading to a better atmosphere and clearing the air per se. So there have been various policies which reduce the air pollution. These could be addressed to the industry, the energy, the transport, the urban planning, the power generation, municipal and agricultural waste management, and the healthcare activities as well. So, as in forms of education included. So, waste management, how we are burning our crops, that leading to so much problem as the parali also that we are facing, burning, which we've been facing over the last couple of years. So the mitigations in which one can do that is by sustainable development, international collaborations, national and international funding, new technologies, and through different media to lower the emissions and the transboundary emissions also. So these are some of the ways and the mitigations. Also, the WHO. The WHO has been a key person to look into this, providing technical support and capacity building to countries and regions, especially the lower and middle economic countries, to evaluate and scale up the health promoting household fuels and technologies, like the burning of the stoves, etc., and the wood fires, etc., that we had. Of course, the natural disasters we cannot help. However, these can be looked after. And also, so there are various guidelines for the indoor air quality and the household fuel combustion. The building of the capacity at the country and the regional levels, and also maintain global household energy database to monitor the progress in transitions to cleaner fuels and stove combinations in households. Thus, contributing to the Sustainable Development Goal indicator 7.1.2. Also, the proportion of the population with a primary reliance on clean fuels and technologies. This also is very important, how petroleum is also now used. Then clean household energy solution toolkits. These are developed as tools and resources which have been really updated now, and also to support the governments to estimate the cost and the health benefits of the implementing household energy interventions. Also convene the Global Health and Energy Platform of Action, the HEPA, and work with countries, researchers, and other partners. Leads to efforts with countries and surveying agencies to enhance, harmonize, and pilot question for national consensus and surveys. Develop guidance and resources for integrating clean household energy into global health and climate change initiatives as well. So this is what we have been facing and seeing, the graph, which has been the crackdown in the national capital as well. And it has been seen that we have faced a lot of challenges in the recent because of the air pollution, leading to a lot of problems and a lot of respiratory diseases, etc. So this is just to end, saying a thank you. The preliminary picture showing the emissions, and the next one flying on to somewhere on an iceberg, the tip of the iceberg, to get some fresh air. And I thank you all very much. So Ritvik is asking, is it possible for an individual to assess the poor air quality impact indoors and mitigation of poor air quality through behavioral survey with help of Apollo in Delhi NCR? I guess it is possible. We will have to get into it and get talking on a survey related to the same, and that's a task that and a project that I can look into. There have been several done also by even the recent past director of AIMS. He did something on air pollution as well. Seeing there are a lot of problems with the air pollutants. He's come up with a lot of papers with this. B. Rajshekhar wants to know what are the plants to grow to purify the air. A snake plant is supposed to be one of the plants which is supposed to be very good for indoor air quality. Plants as such need also sunlight. Snake plant requires less. So you can put that in. Snehata wants to know, will there be a discussion in the context of children from birth to 6 years? So I spoke about the mortality, which is this can be addressed in 2 ways. So it is the maternal exposure. So the maternal exposure should be reduced to the air pollutants and ensure good indoor air quality. Prefer not to be traveling around so that and in an area of a good air quality index. Of course, the plants, the fresh oxygen is very important at this point of time, because we have seen outcomes in the children, of course, leading to problems in the mother and also in the children. So the children, it affects the fetus, and because the mother could have high blood pressure, which could lead to so many other problems. High blood pressure in the mother will lead to decreased oxygenation, hypoxia in the fetus, and also decreasing the weight of the baby. So that is what I said. It would be small in size and the weight would be less. There might be preterm delivery. A lot of respiratory problems could be developed. There are even in the child also from birth to 6 years. Yes, children are more susceptible because the mechanism is a little a little premature in the premature children, and also the immune systems are a little weaker. So that's why immunizations become very important. And also it can lead to short stature, high blood pressure, respiratory problems, asthma, allergic problems, which can be manifested in terms of skin diseases as well. So yes, all age groups, and particularly the children, the elderly, and the pregnant females are very important. Okay, Sangavetran wants to know, my daughter, 5-year-old, low immunity power and suddenly attack cold. Well, yes, it is important to address it. Child, again, should be protected. It is difficult for them to wear masks, but try and ensure good indoor air quality. The air purifiers are helpful. Sudden attacks of cold are allergic manifestations. So allergic manifestation of respiratory problem, which we have seen actually a lot in because of all the weather condition changing, and particularly since I mentioned in the winter time, the smog which happens. So this is all leading to allergic and respiratory problems, bronchial asthma, allergic rhinitis, sinusitis, which is affecting the sinuses in the children. These are all manifestations, throat aches, chronic bronchitis, allergic bronchitis, recurrent and seasonal that we've been observing. So yes, you have to prevent it by doing the same. I hope I've answered your questions, Ritvik, Rajshekhar, Snehata, and Sangamitra. The next question is by Thamarai. How to tackle wheezing issues in such situations with high air pollution? Well, the best thing would be what we can do is the indoor air pollution, which we can take care of. Of course, I'm sure you're not using the stoves, so the centralized LPGs and all have been thought of because of all these reasons. So I'm sure most of us are having that. Which is one of the mechanisms of burning of wood and burning of oil and lamps, etc. These should be avoided. Any thing which is leading to pollution in the air at this point of time, we can avoid, so that this is addressed. Of course, once a person has wheezing, he needs to come to the doctor, because then we need to treat it. And this is an acute manifestation of probably an asthmatic attack, or it could be just bronchitis. We need to look into it really. So please do come, and then we should be able to address it. And as in terms of yes, being around green environment, so do plant a plant a day, or try. Of course, the other thing would be to use air purifiers so that at least the indoor air quality is looked after. These are some of the Jal Neti is one of the other things which is very important, which one can do. It has helped us even in COVID times. So we have seen even with COVID this and things have, the air pollution, etc., has been correlated with that. And therefore, and thus we can avoid these allergic manifestations, which can be in the form of wheezing. Prashant Kumar wants to know, in crowd, I feel suffocation. The best thing is to avoid crowds then in that case, and if it is not possible, you might be having something known as claustrophobia. That is something not related to this, but which probably requires some behavioral therapy also and some medication. But otherwise, for you can just avoid being in a suffocated in a place which is overcrowded, and if there are breathing issues, etc., that definitely would need to be looked into. So you can come again to a doc and find out. Let us delve into it more. So because that could be also, tobacco, passive smoking crowds, and places where they have some lamps burning or something. So there could be some various things to it. So you do come in and we should be able to address that. Varun Kumar wants to know, last year my father was operated for mouth cancer and now he is very weak. So he would have provided a diet schedule according to that. Yes, it depends on the type of mouth cancer and whether it is localized or spread, metastasis has happened, whether he's received chemotherapy, a lot of nutritional support is required at this point of time. And also, very important to know that a person becomes immunosuppressed. That means that a person is more likely to get infections. And diet becomes a very important part because there are antioxidants in our diet which help us to fight the carcinogenic substances and also to give us proper nutrition. So very good nutrition is required at this point of time, and you would need to actually address this question individually, I would say, because we have to see how if he was operated, how much, what part was operated, and how he is being able to take his food. So the diet schedule could only follow thereafter because there could be some from liquid to semi-solid to solid diet, which could be improvised and accordingly. Fruits and vegetables, and usually it's a plate full of different colors is what is recommended in most cases. So this is very important, and that we need to address. Of course, avoid smoking, avoid alcohol. All these things are adding on to our pollutants, even in the system, and leading to a lot of health problems, which can be prevented to most cases. Okay. Since we don't have any more queries, and it has been very, very insightful even for me to go through a lot of data in this regard. And of course, I hope I have been able to give some information to the air pollution and how we can look after it and how we can reform in our small little ways and not add to it. And I hope we can go ahead by doing each one a little act on our own. Thank you so much.